So we're going to talk about the respiratory system. So what we have to think about, respiratory system, it's going to start at your nose, at your mouth. So you have nasal cavity, oral cavity. It's going to go all the way to the back to the nasopharynx, oral pharynx. Then it's going to go where? To the larynx, right? From the larynx, also known as the voice box, to the trachea. From the trachea down to the bronchi. Okay? From the bronchi down all the way through the terminal bronchi and the villi sacs. Because the villi sacs is what makes up your lungs. That's what we're going to have. Your lungs will be divided into two. You have a left side and right side. The left side in the lungs, you're going to have a set of two lobes. Okay? So you only have two because the right side has three. Well, what's in the way of the left side? Well, you have the heart. Yeah, exactly. The heart is in the way, so which means you only have two parts of the lobe because the heart makes up the other part. On the right side, there's nothing else there, so you can fit your three. All of this is going to be housed or protected by the ribs. So how many pairs of ribs do we have? We have 12. Yes, we're going to have 12 ribs. So because you have 12 ribs, it's going to cover every section. So let me see if I can show you. Every section of the thorax from here to here. Which means your lung is not always going to encompass the whole rib cage. It's going to be one section. And as you breathe in, it inflates, it goes down. As you exhale, it goes back up. Right? You have in the way your liver. Your liver is also covered by part of the rib cage, which means that's what it causes. It's going to have you part go up, part go down. You then have little cavities. These cavities are going to be lined with a membrane called the pleura. So there's a pleural cavity, or actually the visceral pleural cavity, and the lungs are covered by the second membrane, or the pleura. The two pleural membranes are lubricated with a liquid, and that prevents the friction as process of breathing and lung expansion. The respiratory system is divided into parts, upper and lower respiratory. So what does this tell us? Well, with the pleural cavity, there's an need to be a little space, and that space allows us for that rubbing to not be there. There shouldn't be any rubbing, which means that when we check a patient and we hear rubbing, it could be the pleural section that's rubbing up against each other, and we call that a pleural rub. We'll see that when we get to the actual diseases. The upper respiratory system, like we said, nasal cavities, mouth, sinuses, pharynx, and larynx. Lower system consists of the trachea, bronchi, bronchioles, and the villi. So the villi will look like a bunch of little grape clusters. These clusters all put together make the lungs. So we have billions of little villi sacs in there. We then go into the breathing process. So we have ventilation. So one inhalation and one exhalation is considered one respiration. So inhale, exhale. Inspiration, expiration. Okay. So the gas exchange occurs in the villi sacs. From the villi sacs to the little walls, we have a little capillary system at the villi sacs, and that's where it's going to be transferring the oxygen in and out. Now, how does the air travel between the villi sacs? We have the pores of Kahn. Those little pores between there allow the air to go through each one of those little villi sacs, which means that when you compress them, all the air is able to travel out, and it's not all trying to get out to that one same terminal bronchi. You are also expelling out through all the other villi sacs, so you can have somewhere to get out of. So carbon dioxide is released in the capillary beds and the villi spaces, and that's called it's going to be called by diffusion. And oxygen moves the same way from the air spaces into the capillaries, transported back into the tissues, and that gives you the full gas exchange.